Everybody, thank you for being here. We are being live streamed. There we go. Does anyone have anything in opening comments? Just good morning. It is a sad day. We'll be recognizing that all day long with the police officer that we've lost. But we have to continue with our work and help others, and so we will get on with it. First, homework assignments, and I know we received a report from you, Cheryl, so maybe we would like to start with you, and Cameron's going to bring it up on the screen.
Okay, great. Good morning, everyone. So we reached out to our association, and we have 38 paid centers right now. 2 are not opening and don't really plan to open, but they still maintained their membership through this year. 1 is awaiting accreditation. 65% of those remaining 35 centers responded, and they provided the following information. Just to let you know that this sample size represented 882 clients, 71% of which are on the Home Care for Elders program, and 29% are private pay clients. So centers whose census have 75 to 100% of their clients on the state rate were 35% of the sample size. Centers who have 50 to 75% of their census on the Connecticut Home Care Program for Elders were 26% of the sample. And those that responded between 25 and 50% of their census were 13% of the sample group, and 0 to 25% represented 26 of the centers in this sample size. Those percentages are for the number of clients, again, I remind you, on the Connecticut Home Care Program for Elders. So as you can see, while this was a significant sample size, of the total, 71%, as I said, represent clients on the Home Care Program for Elders, and 29 private pay. So more of our clients are subsidized through our state programs than our private pay.
And I think it's also worth mentioning, just to add to Cheryl's comments, that some of the centers that have larger participation, where you have centers that have, say, closer to 50 or more participants, is where you also see a higher percentage of home care program participants or state-funded participants. And I believe, it's in the report here, that this also includes the respite program numbers, right, Cheryl?
Yes, it does.
So if I may, this is Anne, as we're trying to address funding of services for adult day services and expanding those services, let's just clarify the data. So either people are on the home care program, home care waiver program, which is Medicaid, and therefore it's subsidized by the state and of course some federal money for Medicaid, or private pay. And private pay is just private pay. There's no blend of that. So one of the things that we have to think about in terms of opening up more viability for people who aren't on Medicaid is, how do we subsidize the programs themselves directly through the state? Does that make sense? That'd be one funding model, exactly, model. I guess that's the word I'm looking for, because hopefully at the end of this working group, we come up with a couple of really viable proposals, and we have a sense of how that can better serve our growing adult day population community to keep folks at home, right?
Yeah.
And also, we were also trying to take a look at how do we access people under 65.
Right. That would be another. That would be another access, but also funding. Like, where would that funding come from? Mag's got her hand up. I'm sorry, I didn't see
No,
it.
no. I was just going to follow up on that with the, obviously people are dependent on most of the people attending depend on public funding to pay for the day center. And so if you're looking at the under 65 population, do we look at Medicaid as an optional funding mechanism for them? I think that's how this originally started, the discussion, looking to see if people under 65 who say had MS or some other chronic condition that would put them within the, 2 to 3 ADLs that were needed. Can we include this in their Medicaid benefits?
And
Early
and
onset Alzheimer's was mentioned
Right.
also.
right, and would that require a change to the waiver?
Or changed the waiver that I think most people are covered by the 65 plus waiver, the
Mm.
home care program. So that's why we originally, I think why the adult day centers came forward looking at the state plan.
Right.
Because I think right now, and maybe Dawn can clarify this, is the coverage for adult day under Husky C? Is that where it gets covered?
It's 1915 is targeted to the Husky C population. Yes.
Husky C.
Mhm.
So
Not-
if someone is on Medicaid under 65, and I should know this, but and is on there because of their financial and physical conditions, so they have 2 or 3 ADLs. Are they in C or are they in B?
So B is the kids coverage, so it's not Medicaid.
Oh,
I
okay.
did, yeah. So if it's helpful, I think that I agreed to kind of put together a super high level landscape of where things are and how it's organized
Mhm.
by financial eligibility. So I have that. It's just a single slide. It's very high level, very rough, but it might help to understand
Absolutely.
like the patchwork of where we are in the state, what we cover, what we don't. And then you might find it helpful to put in a context of what other states are saying that they're doing or not doing, because in some ways, Connecticut is far more progressive than other states. And I'll explain why. And in other ways, they're not. And then we also did put together, we were asked to put together the costs, like
Right.
what it looked like from 2019 to present. And so Pusha's here this morning. She did go through and analyze all of the expenses associated with adult day on the DSS side. So this doesn't cover Margie's older adult program, and it also doesn't include Dorian's social work program. So there's some adult day services tucked in there as well, in those specific programs, not in the actual health benefit that's administered by DSS. So we have both of those things ready to kind of like as an introduction, if
Yeah.
that's cool.
Do you have something Cameron can put up on the screen, or just verbally, whichever, it doesn't matter.
Yeah, so I can show a really, really high level slide and then talk through, if it's helpful, like what the eligibility looks like and how we're kind of organized in the state. So you get an understanding 10,000 feet of like, where does adult day, where is it available currently? And
That'd be very helpful.
yeah, and then Pooja, after, if it would be helpful, Pooja could follow with like, where has the demand gone since 2019 to present? Where are we with the actual utilization data?
Yeah,
Does that make sense?
That would
Yeah.
be great.
Okay, just hold on just a second. I can.
I think Cameron's not allowing you to screen share, right?
You should be able to screen share.
Yeah, I should be able to do that. Hold on. Okay, can everybody see that?
Yes.
Yes.
Okay, so this is a super high level. It doesn't include all of the services for sure, but it does allow us to talk through like what does the purple mean and what does the green mean and what is this? All right, over on the right hand side, the blue and the orange, that's all Medicaid. So what you've been talking about is where adult day might fit into the Medicaid health benefit. So that's on the right-hand side. The one thing I wanted to point out in this slide is that Connecticut currently pays for adult day beyond the Medicaid benefit. So you don't even have to be eligible in our state for Medicaid in order to access adult day. That is a little bit more progressive than some states. So what does that mean? That means that if you're in this, can you see my arrow by any chance? Okay, good. So if you're in this first yellow column and you say I have adult day, anywhere adult day services are available, it's marked in red. Okay. If you're in this yellow column here, that's the Connecticut Home Care Program for elders, state funded. Now, state funded for Connecticut Home Care Program means you're not on Medicaid. There are financial eligibility requirements, but they're not Husky C, they're not Husky D. It's much less restrictive in terms of people being able to keep their income and access services in this state. That's unusual. Most states do not have a robust state-funded home care program that's available for anybody who applies, who's willing to pay the copay, and who meets the level of care. So the level of care, you have to be at nursing home level of care to access that benefit, but not Medicaid. Now, when Pooja shows you the slide, she'll show you how many people are accessing adult day who are not on Medicaid. Once again, it's available to anybody. It's not restricted by a cap in that way, but how many people are actually doing it? To the left of that, you then see the state-funded program for people with physical disabilities under the age of 65. Now, this is intentionally shorter in statute. The ones where there's no waiting list, I made them at the top of the chart. So you'll see this yellow one right here there's a no waiting list policy because it's part of the Connecticut Home Care Program. And this orange column over here is also no waiting list. And I'll go to Medicaid in a second, but I want to explain the left-hand side because these green benefits and yellow benefits are not common in other states, okay? So once again, under 65, there is a relatively small program for people not on Medicaid who are at nursing home level of care and under the age of 65. So if you have certain physical disabilities and you need services and you're not on Medicaid, not spending down, you're not covered, you have not spent down your assets, you have not spent down, and you have probably fairly significant income. We do cover a small group of people. It's a small benefit. It's capped. Adult day is there under the age of 65, state funded as an option. Once again, Pooja will show you what the utilization is within that group. To the left of the yellow columns. So the yellow are both state funded with unique financial eligibility that's been designed and defined by the state of Connecticut. You likely will not find that anywhere else. Unique eligibility. And then once you meet the eligibility, you have to be at nursing home level of care, otherwise in a nursing home, eligible for the nursing home benefit, right? So not lesser level of care. And a lot of times there's confusion about that. In the past, 25 years ago, when I started, nursing home level of care meant nursing home. Nursing home level of care means you have access to nursing home or you have access to community services. That's what it means. So that's why CMS made all these options available to say, otherwise, in lieu of nursing home, you have the choice to stay home. So nursing home level of care means otherwise could be admitted to the nursing home because you meet the level of care standard that we would give you access to that benefit, or you can have a home care benefit. Once again, the two yellow columns, state criteria for financially, you do not have to be on Medicaid. Okay. The green column is new under the American Rescue Plan Act. It does not include adult day as an option, except to the extent that there's respite. So to the extent that a family member would benefit from respite, where the respite option would be adult day for a period of time, it is possible that someone would benefit adult day through the respite option there. Okay, so it's not a standard, every day kind of a thing, but for the purposes of respite. This benefit in the green column, we call it supports at home. We are strategically adding on to the Medicare Savings Program benefit, which is Medicare, and adding a long-term support and service option to those people who are on the Medicare Savings Program. And that option is very strategically focused at family stabilization. It's for informal caregivers. It offers respite. It offers some assistive technology, accessibility modifications. So it's a small benefit, but very, very importantly, intended to stabilize the family. That's what that is. So Medicare savings program, and you have just one or two critical needs. Critical needs are not just ADLs, one or two critical needs. So your age or your disability has started to impact your functionality. And if you're on the Medicare savings program and you have one or two critical needs, then you can access this benefit. Once again, primarily the benefit is to help with stabilization of the family. Okay.
So Dawn, can I just ask you to clarify for folks? This
Mhm.
means like one or two critical needs could be like they're a fall risk, they are maybe missing meals or not, able to take their medication without, medication administration, that kind of thing, right?
Yeah. Two critical needs, need assistance with meal prep and
Right.
medication and management. Those would be two. It's exactly the same criteria.
Yeah.
Guys, down in this blue box. So if you're familiar with the home care program, what's called level 1 or level 5. So that's
Right.
prior to needing nursing home level of care. So these are people
Right.
who would not be admitted to a nursing home,
Right.
but are starting to, where their age or their disability are starting to impact their functionality. And we
Right.
have a measure of that. And if they qualify by meeting that threshold for functional need, they can access this benefit. We're really excited about it. We're expecting that it'll go live in December. It's been a lot of work on that. It, once again, does not include adult day on a daily basis but it does for the purpose of respite.
So when you say for the purpose of respite, what I see in the community is that people who can't leave their loved one at home and go to work or go, for very long, like, so that's why it's helping the family stabilization, because they're tied to the home to watch out for their
Yeah, and it
person.
probably, thank you, Representative. And it probably wouldn't be daily. This benefit wouldn't be
Right.
daily. It's a more limited benefit for that than
maybe once a week or something, so that they can like go do what they need to do, right?
Yeah, it's more, otherwise you're doing it. It's not every day. Otherwise you're doing it, but every once in a while you need a break.
Right.
So it's more for that.
Yep.
And then on the purple I put on here, this is the program that Margie is responsible for administering, and Dorian. I tucked those both in the purple box, and they have different, eligibility criteria. But those programs are both available in the state. Excuse me, and they do include adult day. So, okay, so then working from the left, you see the purple category. The colors indicate different financial eligibility.
Mhm.
So they're coverage groups. Think about it like that in a way. And so same as when you pull out your insurance card and you go to seek medical care somewhere or enter your information, a lot of times it'll say, what's your group? You go on your card and you say, oh, here's my group number, XO25, like, where did they make up this number? That's a coverage group. And that actually defines what benefit you're eligible for, because it's a group. And that group all has the same benefit. So the purple has two different groups in it, the group that Margie's covers and the social work, the Swiss program. The green is a different group, Medicare savings program. That's the group, the coverage group. The yellow is a unique group defined by the state. So it has different financial eligibility, right? The higher income, and frankly, no income test and an asset test. And then we'll move into what is the Medicaid program? Now, I wanted to talk about the yellow, green, the purple first, so that you understand that what Connecticut's doing is not just Medicaid, right? There is a significant amount of dollars that's going to those individuals who are not yet on Medicaid, giving them access to adult day to help stabilize them prior to actual needing to be on the Medicaid benefit. Now, those individuals in the yellow group, they only have coverage for long-term supports and services. So for the menu of things that help them stay at home and avoid nursing home, they have state coverage. Otherwise, for their medical needs, they don't have Medicaid for medical. They're accessing their private insurance or they're accessing Medicare, right? So it's not a total benefit, it's not a whole comprehensive benefit. It's just long-term supports and services. It's help with their ADLs, it's help with their IADLs, it's help with their functionality, their needs related to function, okay? By and large, the blue bar on the bottom that you see, that's the Medicaid basic benefit. That has multiple coverage groups. I don't know how many we're at right now in the state of Connecticut, could be 24. I mean, we have a lot of coverage groups in the state. Those coverage groups are by and large defined by the federal government because it's a federal, in our state, it's a 50-50 split, or could be a little bit different depending upon where we are with the public health emergency. But in general, it's shared with, it's administered by the state, but it's a federal program, right? Administered by the state has some control. The Medicaid benefit in all of the states is very, very different because states have some control over what they offer and what they don't. Now, some things are mandatory. If a state wants to operate Medicaid, there are some things that the state's required to do. Like, for example, you have to provide hospital coverage. That's a mandatory, and that's called a mandatory benefit. And then there are other things that a state can have that are optional. And that menu is different all over the place. States do have some flexibility over like what the coverage group, like what the income groups, little tiny bit of flexibility over the income groups, but I would say not much. The basic Medicaid benefit of the state is the same as you having an insurance card and you know what your coverage group is, and you make a phone call to say, is X, Y, and Z covered? And you find out it is or it's not. That's the basic benefit. You have a card. The card entitles you to certain things. You know what you have access to for medical, dental, or whatever. And that is your basic benefit. There's no difference if everybody here at this meeting has the same group number. Nobody's getting treated differently. If you need it, you get it. And if you, because it's part of, all of you have the benefit. That's the blue box. The blue box is everybody has the benefit. It's the basic benefit. Everybody has hospitalization. So if you have Medicaid in our state, you have hospitalization coverage. If you need a PCP, you have PCP coverage, right? Those are the basic benefits. Every coverage group in our state has access to the nursing home if they meet that level of care. We don't distinguish, well, you're on Husky D, so you don't get it. We don't do that. It's fair access to everybody. Everybody has nursing home benefit. The actual comprehensive benefit that can help people stay home, regardless of age, regardless of disability, only based on functionality, is community first choice. It is part of the basic benefit of Medicaid. What does that mean? Well, that means the state can't limit access, just like we can't limit access to hospitalization, right? We can't say, sorry, we met our quota this year, no more hospitalizations, or Mrs. Smith, you're done, you can't. That's not what we do. It's an entitlement. If you need it, the state provides it. So community first choice is an entitlement for people at nursing home level of care. That includes Husky. All coverage groups, which we bundle them together to make it a little bit easier for people to understand, Husky A, Husky C, and Husky D. So Mag was talking about Husky C. Husky C is the coverage group that covers people who are older adults, people who are blind, and people who have physical disabilities. That's the basic. If you have a disability or you're an older adult, in the old days we used to call it we used to separate them, but we don't anymore because the federal government and the state's moving more towards functional needs versus this is your age, so this is what you get. It's more of a global approach to say we should create fair access to people regardless of their age. It's about their functionality, not about their age or their diagnosis, okay? So the blue benefit does include, for people 65 and over, this is Medicaid entitlement, does include long-term supports and services for people who are not yet at nursing home level of care. So it's a progressive kind of a benefit that says you only have 1 or 2 critical needs, but you have access to Medicaid long-term supports and services as an entitlement. Once again, it's in the blue box. It's an entitlement. So within the benefit, if you're 65 and over, you have access to adult day. If you're not yet, now, that means you have to be eligible for Husky C, right? So as long as you're eligible, as long as you have Medicaid as a medical benefit, if you have access to Medicaid, then you're in 65 and over, you have access to adult day. And once again, you're not at nursing home level care. It's 1 or 2 critical needs. That's a relatively progressive threshold function in order to get access to the benefit. So access to benefit is about having the insurance card and also about needing the service based on your functionality. Our need threshold for adult day, very low. It's easier to get adult day, qualify for the benefit in our state than it is in most states, because 1 or 2 critical needs is a relatively low threshold to get access. Now, on top of the basic benefit, we have things called waivers, and they sit basically on top of the basic benefit because the state can, in offering the orange boxes, the word waiver means we're waiving fairness in some ways. That's why you would get a waiver. You waive comparability. In the blue box, anybody who's eligible, it doesn't matter. They get access. You can't say, you know, you are 25, so you get it. You're 28, you don't get it, other than the what's called the 1959. It does allow us to target. But other than that, you cannot waive fairness and comparability in the Medicaid. It would not be fair. It's a Medicaid healthcare plan. If people qualify and they need the service, they get it. Waivers, the state waives what would be fairness in comparability to just target the services in the orange boxes to certain people. And when the state does it, and they do it in order to offer more services to those people, not less. So the orange boxes sit on top of the basic benefit. And if people qualify based on the functional eligibility for those 2 columns, then they get access to even more services under Medicaid. And that's what, once again, that's what we call a waiver, because we're waiving comparability. We're not giving it to everybody in the blue box. We're only giving it to the people who qualify for these special sets of services that are defined in what is the orange boxes. The orange box on the right-hand side is the Connecticut Home Care Program. You're probably very familiar with that. It's a large program. There's no waiting list for that program. The state has the right within the waiver to limit access by having a waiting list, but our state does not have a waiting list for over 65. Under 65, there are several different waivers that are based on functionality or diagnosis. So for example, people with autism have a separate waiver that's targeted for people with autism, people with brain injuries, people with physical disabilities, and so on. So they're targeted to certain groups. They're all separate waivers. They all have separate additional services. Once again, the waiver means we're waiving comparability and offering additional services to people who meet the criteria for that specific waiver. And there's a wait list. So we cap access to the benefit. The waiver can also do that. The blue box, the basic benefit, we can't cap enrollment. If people qualify, they get access to healthcare. The orange, the additional services, we can cap enrollment. So if the group is talking about adding to the state benefit, you'd be adding to the blue box. You'd say, I want to create a new entitlement, and there are very prescriptive rules about how you can do that in order to meet the fairness standard or whatever the rules are within the authority that you're trying to put adult day into. I wanted to show this just in super big picture, just to make 2 points. One is we do have adult day in the state plan, and the threshold for qualifying for that, if you're on Husky C, is actually your functionality. It's a very low threshold to get access to it. Number 2, I wanted to point out that even if you're not on Medicaid, we have a pretty robust home care program, 65 and over, for people not on Medicaid that also covers adult day, and then a smaller package for people who are under the age of 65. In general, the state has not had the same policy related to people under 65 as over. People over the age of 65 do have access to a relatively robust menu of services, even if they're not on Medicaid, if they meet the financial requirements. And the state has had for many years now a no waiting list policy for people 65 and over. Under the age of 65, as I mentioned, the little orange box, we do have capped enrollment in the programs, and we have far more fragmentation under the age of 65 because most of the programs are designed, once again, based on a diagnosis or a specific disability. And so they're very, very unique packages under the age of 65. So if the question is, where does it make sense in terms of the menu of services where the state is right now to add adult day as an additional benefit to someone somewhere? To me, the first question might be, let's look at where the demand is going. And then revisit this slide to talk about, does it make sense to add just adult day for people under the age of 65 when other options that might be defined as what they call less restrictive? Does it make sense to look at this through the broader lens of how do we create equity and access versus just offer access to one specific service? Because in doing that, you're creating supply for just one service, but there are a lot of other people who, if they don't choose that service, does it make sense to just do that versus having a menu of services or access? I think to me, that's kind of a structural question. Would it be helpful for Pooja to share? Do you have any questions about this? And would it be helpful? I went pretty fast, but hopefully the boxes are, I don't know, hopefully it's helpful in some way.
I have just one quick question.
Mm-hmm.
Dawn, do you know what the waiting list is for the small orange box?
Oh, it's well over 1,000 people. I don't know what the number is, but it's at least 3 years for physical disability. And let me just say, the community first choice option, we do have that in the entitlement, but it's self-directed only. So if people want an agency-based option, which, self-direction is great, but it's also a lot of responsibility and a lot of work. I mean, you have to be willing to hire your own staff, manage your own budget. So there's, it's as far as if you look at a continuum of services, self-direction is on the far left. It's the highest degree of autonomy for members, but it's also the most work. And some members who have functional needs really prefer to kind of share the responsibility a little bit more. And an agency-based option does share, because then you just call the agency is responsible for the backup.
And then I don't know if you said it, but does the small orange box go through the access agencies also and get a care plan?
Yes, the small, all of the DSS waivers. Now, I didn't include DEMAS here, or where there was a mental health waiver, and I didn't include DDS. But if I did, they would be in the small orange box where there is a wait list. They're all capped. The only waiver, once again, the waiver sits on top of the basic benefit and offers additional services to people who qualify, meet the standard for those extra services. So we waive comparability, but sort of in a good way to offer more, not less. That all of the other waivers other than the home care program are capped, and there are waiting lists.
So if I'm under 65, I have MS, I wanted access services, I would go to the access agency, apply for this waiver.
You would probably apply for the PCA waiver, or you could apply for community first choice. I didn't get into the details. The
Right,
waiver,
but I mean, I would go there and then I get, if it fell in the orange, if it wasn't community first choice, and I'd be put on the waiting list.
you would be put on the wait list.
Thanks.
That's right.
Any other questions? Go ahead, Chrissy.
My unmuting. Dawn, this is so helpful. Thank you so much for putting this together, because it really gives us like a much more clear picture of the breakdown of services. So now my personal mission is going to be to understand how I can fit our potential clients into these boxes. Because as of right now, and Cheryl can either agree or not agree, I think that the majority of centers are using the far right orange box only. So I think that, and like my center personally, we have a waiting list of people to get approved, for one reason or another, are not getting approved to fit into that orange box on the far right, of about 37 people. Out of those, I have a few people that are under 65. And just to make an example of one gentleman is under 65, he's in a wheelchair, he is in a nursing home right now. And his social worker from the nursing home is calling me consistently to see what, if anything, I can do to admit him to my program. And I've told her at this point, aside from private pay, I don't think there's anything. But now I see this smaller yellow box, the 1, 2, 3, third box in. So how do we access these boxes for our potential clients? Like if there's a different program or a different number we need to call or a different type of coverage. So that would be one question. And the same thing with the larger yellow box, because that one, I believe you said, was different income requirements, where we have people that have been told they're slightly over the income for the far orange box. So how do we put our people in these boxes? Because I think that would be a first step to helping. And that's my first question. And then if there's time, I'll have a second question.
So the two yellow boxes have the same income and asset tests. So the yellow box on the left is for people under the age of 65. The yellow box on the right is for over 65. So if the individual who is in the nursing home who would like to return to the community and use adult day is under the age of 65, then and is not on Medicaid. So I'm assuming not on Medicaid because it sounds like they're over income, then the program that individual would apply for would be that first yellow box, which is
what's the name of it? Right, I'm going to write it down right now.
It's called does anybody else remember? It's called the I'll get the exact name. If you if you just apply, though, they should help you. They should point you in that direction. It's
Dawn, is it like Connecticut home care program for disabled?
for physical
Category
disability?
4?
Yeah,
Category
you might be. Yeah, you might be right. Actually, can you just look that up while you have it on your slide deck anyway?
Yes.
And who were they talking to, Dawn, when they were asking for this? The Access Agency or DSS?
You're probably applying through DSS.
Yes.
Yeah, you're probably applying through DSS. And if you choose that program, I mean, once again, there's an income threshold, right? I mean, excuse me, there's an asset threshold. So you'd still have to qualify. You have to get the insurance benefit. And the insurance benefit for all these programs is based on your income and your assets. So you have to kind of be within that range of income and assets. And if you're not within that range of assets, then, you, and some people do this, create trusts or ways that are federally approved. If you're at a certain level of disability, you might be doing that. Now, Chrissy, if the gentleman that you're talking about in the nursing home is on Medicaid, the first question is Medicaid that I would have, and we can get into the weeds about the individual. It might be helpful to do that because it can get a little bit more complicated than just the boxes. But the first question is, it sounds like this individual, if he wanted adult day, would be trying to apply for the home care program for people with physical disabilities. Now, there's a wait list. Don't forget that any column that's not at the top of the page, like this yellow box, there's a waiting list. So that's not this green one, but the yellow boxes and the orange boxes that don't go to the top, there are waiting lists. So you'll be.
But he is on Medicaid. Sorry. So he is on Medicaid though. So how would I have to direct him through the Access Agency? But they won't entertain it because he's under 65. Medicaid's paying, maybe I'm wrong about the type of coverage because I'm learning this right now, but I know the social worker told me Medicaid's paying for him in the facility. and he has a wife at home, but the wife works. So it's not safe for him to come home unless she has a plan in place and so on and so forth.
Yeah.
So
What, you know what I would tell him to do if he didn't do this already? I would tell him, since he's in a nursing home, he should apply for money follows the person. And because based on what you're telling me, he qualifies, and we will literally help him. We have universal case managers in there that will help him navigate the system. Tell him
okay.
exactly what to do. That's what I would do.
So
I
that's
would
all
apply
through
for-
DSS. So we should be directing him to DSS directly.
Apply through money follows the person.
Okay, that's also great to know. Thank you so much.
Yeah, if you're in a nursing home, you should apply through money follows the person.
Great. And I want him to utilize the social worker. They have a social worker in the nursing home. Once he gets home, it may be harder for him or his wife to kind of research all of this. So that's why I'm trying to help him to utilize the social worker. She called me a few times. So that's great. This is very helpful. So we need to kind of explore and take some time to learn more about the different types of these DSS programs. And the same thing with the tall yellow box, right? So that's for 65 and over. Is there a name for that one that we could use to contact?
That's the Connecticut Home Care Program. So we use the name Connecticut Home Care Program generically, and it covers a lot to make it easier, but it covers a lot of these columns. So if you're 65 and over, it's Connecticut Home Care Program. And if you apply, then internally, we see if you fit into any of these columns so we can provide services. But it's a generic term that we use.
Got you. So that one's still the home care program. We would contact the access agency for that process. Okay. All right. This is good to know. This is excellent. Thank you so much. And it's very helpful so that once we understand this a little better, we can understand what, if any steps we need to take to target the people that don't have access to our programs right now. And the folks that we had intended to target are those who, through some way or another, have access to other services like home care or being in a nursing home. So our goal was to offer them a cost-saving choice by saying, look, these people, Medicaid will pay for these people to be in a nursing home or pay for them to have full-time home care. Why not? Let's allow them the choice of a lower cost option that would be less for the state and, in our opinion, more inclusive and better option, because of course we're biased. But so this slide is really helpful, and I'm hoping that if it's possible, we could have a copy of it if someone could share it, or we could have a copy of it.
Yeah, and I can add more detail, kind of reflecting some of your questions, because I didn't put the exact names of the programs, or like Mag, to your point, like, so how do you apply? Where would you apply for these different, just to make it easier? I can add to it. That could be a product of the work group.
Okay, thank you. We have a couple of hands raised. Mr. Carlo?
Yeah, just a kind of I guess more of a comment or an observation that this is all very informative, but it seems as though there are the providers who are on this committee that weren't even aware of some of these programs. So how do we educate all of the providers? How do we educate the people in the community as to what their options are? And I think that's really kind of going to be key to all of this, is getting that education out and making people aware.
Yeah, I think you're absolutely right. Going through my mind was, does my social service people in our town and the senior center and social services know this and understand it? Because it is very overwhelming as a person not involved in social services, and it is extremely helpful, Dawn. So thank you, but that is a good question.
Yeah, I mean, the social workers in all of the nursing homes, how do we get this information to them? Yeah.
So for the nursing homes, once again, first of all, Mary, that's a great point. Lack of access to information is still the primary reason in the state that people are institutionalized. They just don't know. And it is complicated on the community side. I mean, you see these columns, it is a level of detail. There's a lot more detail behind these boxes, right? But I wanted to keep the conversation like at 10,000 feet. So at least it's a structural kind of a conversation. If somebody's in a nursing home, they should apply to money follows the person, because the staff, the DSS staff who are in there, and it is access agency staff, great deal of training always have information. They literally know when the next new program is coming online. And one thing that we've seen, this is specific to the nursing home, is that especially through the last 2 years, with COVID-19, there was always a lot of turnover, at entry-level positions for all of us, but there's been a lot more through COVID-19. And so I think the re-education piece cannot be understated. And really the best thing to tell people to do is just to apply to Money Follows the Person, because that staff are meeting on a regular basis. They're having the most updated information. They have direct access to eligibility workers at DSS. They have access to policy decision makers, so that they can interpret policy and help people probably more quickly, definitely more quickly than any other option. And that's really because, in recognition to what you're saying, we're trying to create a more universal approach. Just talk to one person who then will be able to triage for you, because otherwise it's going to be complicated for you to do it on your own. And really people just want to know quickly. My experience, and I'll tell you, when I first started, we named everything a different program and we were going to provide all this information. It confused people. And frankly, what they wanted to know is that they were going to get assistance that they needed, and that it would be reliable. And my experience was they really didn't care what the name of the program was. What they cared about was making sure that the service was there. So some of the details and the weeds we'll get into, just like, what's the name of the administrative authority? People don't care. I mean, in Medicaid, we're the only ones who translate things into Social Security numbers, right? And but the general population doesn't. They just want to make sure they get access to services. The other thing that we have done, and Marky's worked really hard on this too, through the Aging and Disability Resource Centers, and Marky, jump in. I don't know if people should just call Choices or go to the Aging and Disability Resource Center, but it might be a good opportunity to mention that. And then we do a website called My Place CT that attempts to kind of make it easier for people to understand. So My Place CT is the DSS universal site. You go there and you can get access to this. But Margie, did you want to say anything about Choices, just in respect to people getting access to information?
Sure, and Choices does provide that information, and it's through the area agencies on aging, where now they've also hired service navigators to help navigate through these different programs and all the different options that are out there. So going through that Choices line, the 1-800-994-9422 is the way to get some of that help. That's one access point for people that should be helpful.
Yeah. Really important, because getting into it's very, very complicated, and the information is changing all the time. So, having the most updated information and then trusting the Choices counselor, just getting that phone number or going on the website for My Place CT, probably the absolute best thing somebody could do. And if Marky's staff have a question about Medicaid, they're just going to call us and we'll answer the phone and tell them the answer. So, it's probably the best thing for people to do.
All right, thank you both. That's very informative. So there is kind of one or two places that people can go to that help them understand or where they place best in this whole system. Is that what I'm hearing?
That's right.
Okay, thank you. Mag, you have a question or comment?
Yeah, I mean, I think Dawn was answering my question, because that, where do you apply? Where, like, if I'm an association, right? I get a lot of calls. I usually send people to the access agency in their area, but knowing the Choices or My Place CT is also the place that people would go. That's really helpful. And I think if we were able to get that information out to lots of people, that would be really helpful. Because you're right, Dawn. When you need help, you never look at this stuff until you need help, right? And then where do I go to find out who's going to triage me? That was the key word, triage. Who's going to triage me as to where I might go? Mm-hmm. The second question I just had is, so if I'm an adult day center and I'm certified by the association, so I can take home care program for elders clients, am I certified for any of these programs where adult day is a service?
I would have to check. I don't know if Jen, I can't see everybody. Is Jen on here? No, I would have to check it. It is true for respite in the show benefit. It is true certainly for the home care program. yellow, all yellow boxes and the far right orange box. The only program I'm not positive about is the adult day. I believe that there's an adult day option for people with brain injuries, but I don't know if there's an additional certification. So I can check and get back to you on that. And I'm not positive about the DD programs. I can look it up, or we can get back to you on that. And Margie, I don't know, do they have to, what are the rules for adult days for your programs?
Yeah, I'm sorry. I just had to take a quick email, so I missed what you had shared, John.
Yeah, adult day, Mag was asking, are all adults, I believe the language for Medicaid, and this is anybody in the yellow boxes, orange or blue, where you see adult day, that's all certified by the Adult Day Association as an adult day center. That's what the certification is. And the qualification actually says that for the provider across the board. In order to be an adult day, do they have to be certified by the Adult Day Association or no?
That's what we go by, yes.
So it's the same.
We go by the same thing, same process. And a lot of our processes are following and piggybacking on the DSS processes, the requirements and the rates, but we do have our own eligibility. That's the one thing that is different for us. But that's correct.
So just a quick question. I hope I'm not repeating. But just based on that. So that sounds like for the yellow boxes and for the orange boxes, that all would be, as a provider, we would go through the home care program.
You would.
It's all through the access agency.
Yes.
So the two yellow and the two, the big orange, those are through home care program. If we're certified by the association, and then we also have to get accredited by Allied. So if we meet those two, which everybody is, so we meet those 2 points, we should be able to accept clients and get approvals for clients in the 2 yellow and big orange box. I believe for the small orange box, which you said includes the PCA and brain injury waiver, there is an additional step. We're actually trying to go through it. My program's trying to go through it now for the PCA waiver, to take a client on the PCA waiver. There is an additional step, but it starts with the same certification. It's just like an additional process in the DXC, or I'm sorry if that's not the name of it anymore, system online. And then for the purple box, which would be Miss Margie's programs, that one is, all we need is the certification from the Adult Day Association, and we're all also accredited through Allied. So I'm sure that whether it's required or not, we have that. And then, so what about just the plain blue box?
Same as one. Yeah, I misspoke. The blue, it's blue, all blue. The blue is the same as the 2 yellow and the large orange. How about that? The
So
only
it's also
one,
home care, the home care program.
DSS is trying to create a universal approach. And so for DSS, it's really the access agencies are the case management entity for DSS. For the most part, there are some, there's a new program called CHESS that I won't go into, but for the most part, any box on here, yellow, blue, or orange, or green, other than purple, everybody's the access agency.
My green was blocked. Gotcha. Okay, everybody's the access
Purple's the only one
agency.
that's it. Yep, all the other, all the boxes are the access agencies.
Okay.
And credentialing through the fiscal intermediary, as you mentioned.
Of course, yeah. Yep.
Yeah.
Thank you.
Yeah.
Thanks.
Any further questions? I'm sure we'll have more as we go along in the next meeting or two. So when I first heard of this from my adult day center, and I talk about it with other legislators, all I hear is, well, you can't do anything. There is no money. So how, and I'll call on you in a minute, Ann, I just saw you. Do we know what increases we've had, how we've broadened our scope over the years?
Mm-hmm.
Have we been stagnant for how many years with the need increasing? Those are just all general questions to understand what the need is, where we have to go, And if there is a true need in our populations, and this is something that we really want to go, then we have to go for some money. Or what other options do we have? And I'm not saying, new in Medicaid, whatever it is. So I'll just leave you with that question for a minute while Ann asks hers.
Thank you, Representative Garrett. I think you're exactly right, is that we're shifting now that we have a better understanding of how this is offered, if you will, and funded, because like Don said, a lot of the funding is 50-50 if it's through the Medicaid program. The state is putting in 50. So if we expand, obviously, slots or the community first, which is, there isn't an income thing, then how are we going to fund it? So that those are two that I think that's a fundamental issues that we need to propose through this working group as well. But the thing that we were touching on is access to this kind of complex information. Let's face it, like we're just learning really the details of that. And I get calls all the time from family members out of state who have aging loved ones here. I've got several right now that are trying to fly back and figure out services, And so I think My Place CT and those things are good. I'm not sure that out of state, adult children are looking there and are getting directed to those access agencies the way they need to be. And I'm wondering if part of the proposal is really streamlining, because the elders themselves can't do it, right? So we can't put the burden on the elders themselves. So we need to figure out, multiple ease of like online ease if they're applying for something, or if they're picked up from, I don't know. A lot of times it's adult children that are the first access point, quite frankly. They're not the area agencies on aging. So I'm wondering how do we bridge that gap?
Right.
I mean, I think that, or sometimes it's the doctor's office, or, the social worker at the nursing home. But Representative Garibay, to answer your question about we have seen demand for home and community-based services go exponentially skyrocket, quite frankly, over the past couple of years. It was already on an upward trend, and it's more of a snowball. As I mentioned, it's lack of access to information. The more people who access home and community-based services, the more discussion in the community there is about home and community-based services. And the word of mouth does have an exponential effect at a certain point. And we saw that happening before COVID-19. And then with COVID-19, it became much more, I will tell you, our unit received so many phone calls from doctors' offices about home and community-based services. We never got those phone calls before. But all of a sudden, there was a need to figure out what is an option in lieu of nursing home. The family is telling us they don't want to go. What else is out there? And so we saw hospitals and doctors' offices reaching out on a very regular basis to learn about what the options are. Once somebody learns about the options, then that access to information is there. They know you're not going to unlearn it. But what we've seen and what Pooja put together is we have seen, while the curve for home and community has gone up, while we've had lots more members access home and community-based services, we have seen a decrease in the demand for adult day. So I'm not sure that that's because we lack supply. It seems to me that there has been a shift in the demand. We've seen that go up a little bit, and Pooja has it in. We've seen it just rebound a little bit, but it seems at this point that there may be some impact to the demand long term, just in terms of preference, because we have to offer choices. It's Medicaid does, not just one thing. And if we offer choices, we want to make sure they're quality choices. And hopefully, DSS is doing a good job of that. But she does have the trend data, if it's helpful to take a quick peek at that at this point.
Once you make one comment. I think that sometimes organizations or really good services aren't very good about letting the public know about that service. I know our day center has revamped this past year and has been using social media and all the, so people are, oh, we have that in our town. I would say that many people did not know. So I think that's one. And so I understand what you're saying, that it's, I would like to see those numbers on the what's going on there, if you have that.
Sure, Pooja, did you,
I do I have it in an Excel file. I can show that. Okay.
and if it's okay, Pooja, you'll just find, if it's okay, I have to jump to another meeting. Pooja can certainly explain the data, if that's okay.
Yes, thank you. And thank you for everything today, Dawn. It was
Sure.
great.
Thank you.
Sure. I will try my best.
You'll be fine.
Thank you. Okay, so so this is the graph for Connecticut home care adult daycare expenditures. And I put together this graph for state fiscal year 19 to 2022. And it's by CSCPE waiver categories. So waiver category meaning category level 1, 2, 3, 4, and 5. And as you can see, the total, the highest expenditures were in 2019, state fiscal year 2019, roughly 14.8 million. And then it dropped in state fiscal year 2020 to 12.9 million. And then in state fiscal year 21, it dropped to 9 million. And then it came back in state fiscal year 22 to 9.7 million. And just a little bit, I know Dawn mentioned, went over about different benefit groups. But I just wanted to mention that here category level 3 and category level 5 are federally and state funded. And category level 1, 2, and 4 are only state funded. And so and specifically the category 4 is for the people under 65 and they are disabled. And all other categories have are for the adults that are 65 and older. So level 1, 2, 3, and 5 categories are for adults that are 65 and older. And to access these services, there are functional need, as Dawn mentioned, care plan, as well as the financial eligibility to qualify in these categories. And so that is the slide here. And this table represents the actual expenditures. And I pulled these expenditures by date of service. Do you have a question, Mary?
Yeah, Mary.
I do, and I may have missed it before. So
Okay.
category 4 for the under 65, how
Yes.
long has that program been available? Because it doesn't look as though many people are accessing it. And
Right. It has been available for a long time. There is a waiting list. And based on my table, I don't know if that table, when that table last updated, but there is a limit of 100 people, I believe. So there is a waiting list. So it's a very small group, and as well as, so that's why maybe when people go through this evaluation, they don't qualify because there is a waiting list. And also category 1, they are no longer accepting any application for category 1. So the option is category 3 and category 5, and as well as category 2. But there has to be there are different levels. So like there has to be a functional need, there has to be a care plan that has been created for the members, and as well as the financial eligibility, like income and asset limit to qualify for this category.
So if
program.
there are thousands of people on the wait list for category 4, would it not, shouldn't we maybe put a focus on how can we open those services up a bit? Again, where does the money come from for that? But if there are, thousands of people that need that service, how can we open that up to people and provide it? So.
Yes, definitely. And I think Dawn can explain in detail on that. Is Dawn still on?
No,
Um,
we can talk about it next meeting
Okay,
too.
yeah.
Yes, yes, I'm sure. I can put together the data and I can present the data, but as well as like details on the programs, Dawn has a better understanding and on that side. So any question on this?
Chrissy,
As you can see, the category 3 has the high has the majority of the expenditure. Because these members are kind of are eligible for both Medicaid as well as they are eligible for this waiver program. So and this program is funded by both federal and state. So it's kind of a main program. While the category 1 and 2 and 4 are funded by state. And there are limits on to qualify for this categories.
okay,
Hi, Meg.
thank you, Chrissy.
Sorry. First of all, thank you, Ms. Pooja, for this is a very comprehensive picture and is very helpful for us. And I wouldn't worry. I think you speak eloquently and directly and perfectly to all of your data. So thank you so much also for speaking with us. So we thank you for that. I'm sure everybody does. I just want to clarify a few points and we can, if needed, we can wait until the next meeting with Dawn to kind of just go over them. But so one thing I want to just make sure everybody's aware of, as you see the trend from 20 to 21 with the decrease, I'm sure we all know, but I'll just say it out loud, is obviously related to COVID and the closure of several centers. My center particularly was closed for in-person services for over almost a year. And as in 2021, centers were rebuilding, centers were reopening, there was space limitations, there were van limitations, there were so many limitations of bringing people back in person that it makes 100% sense that the numbers decreased. I'm not sure if that actually reflects demand per se, because I think that people still want the service, obviously, as you see it coming back up in 2022. So although normally under normal world circumstances, you would say it could reflect demand, I think it reflected the situation that centers were facing trying to reopen. We lost several centers closed and haven't been able to reopen. Cheryl mentioned that we have 2 centers right now that still aren't open. So that's why I think you see the decrease, not so much that people don't want our service, but that it was really hard to for us to provide it and for them to accept it during 2020 and 2021. So with that said, I love that the blue bar of 2022, so go blue, is increasing and on the right trend. And as we close out 2022, and you see, I'm not sure of the actual dates of fiscal years and how they run for this purpose of this chart. But as we get to the end of 2022, I would venture to guess that you see that blue bar go even higher. And in 2023, it's going to make it our goal as an association of programs to get that blue bar. Maybe the next year we can use purple. That's my favorite color, and it will be the biggest bar of all. So I like to see that data. So that's very helpful.
Right.
Pooja.
Sure. I can just briefly tell you. So this is a state fiscal year. So it runs from July 1st. So July 1st to June 30. So the state fiscal year 22, meaning that this data is showing from July 1st, 2021 to June 30, 2022.
Okay, that makes sense.
So that's why there is a biggest drop in state fiscal year 21, because it's the pandemic fiscal year. July 1st, 2021, actually July 1st, 2020 to June 30, 2021. So that's why there is a
Beautiful.
biggest drop on that.
So we don't even see what we're doing right now isn't even yet displayed on this graph as like the reflection of today, exactly today. So I think, yes, that the new bar should be purple and it's going to be a beautiful height higher than the blue. So thank you so much for that. And then I just wanted to clarify one more thing, and then I know other people have questions. Because I want to make sure I got exactly Pooja's statements from my notes. So category 1 on this bar is closed. Category 2 is a smaller amount. Category 3, I would venture to guess, is where the majority of our clients are right now. Category 4 reflects the under 65 group that Dawn spoke about, but it only allows 100 people in the whole state.
That was the table I have seen, and I have it, but I don't know if that number has been updated to how much. I cannot confirm
Okay.
with that number.
That's okay. We
But
can
I
ask like
think there is a
representatives.
waiting list for that category right now.
Okay.
I think that was the short orange box, right?
That's what I was thinking. No, the short
No.
orange box is separate. This is the small yellow box, right?
Actually, no, I meant sorry.
Not
these
your
are the
orange
state
box, but
fiscal year.
Dawn's orange box.
Oh, Dawn orange box. I believe yes. Orange and yellow, I think she had.
Yes.
It's okay. We can clarify with her. Don't worry about that. No problem. But I believe you said that the category 4 is the under 65 group.
Yes.
Okay, so that allows 100 people in the whole state and there's a waiting list. So I think maybe Miss Mary made a point that we need to explore that. And then category 5, I was writing and I missed what you said. Could you please tell me category 5 again?
I believe that category is both federally and state funded, and it's for 65 and older.
Okay.
And of course, there is a different. I believe there is a different financial eligibility. Like there is a different break point between category 3 and category 5, and I'm sure there is a on the functional need as well as the care plan. So I just wanted to kind of mention that there are columns, different columns. So one column is the functional need, another column is care plan, financial eligibility, and there are different breakpoint where member fits on that category for the services.
Thank you. Thank you so much. This is great. Thank you. I'm sure we'll talk more with Dawn next time too. Thank you.
Sure.
Thank you. Mag.
I think most of what I was going to ask is covered. And because I was going to ask about 5 too, because I was thinking 5 was the base blue people that are 65 plus, basically, and they don't need all the care. They don't need they only need like one function, right? So, but I was going to say the same thing everybody else said about category 4, which is, those are the under 65. That would be have the home care program eligibility, which has the limit and the 3-year wait list. And if you look at what Dawn was saying is about are we looking at one service we want to provide? Or are we looking for sort of equality in services for people under 65 who have, needs of services and support? So maybe it's in the next meeting, we could put on the agenda a really good discussion about that category 4, because I think there've always proposals to expand it. So I think the cost of that has been estimated in previous legislative years. So maybe the DSS has a good handle on what it would cost to increase the eligibility or to take the cap off of category 4. Because I know this has been discussed in previous years in the legislature.
Okay.
Yes.
But it doesn't seem to go anywhere, is correct? Probably
And I
not.
think it might be because of the cost.
Right.
I think,
Okay, thank you. Mary Pat.
Yeah, just one final question. And this kind of goes off of what Chrissy was saying. So right now, today, because of agencies and programs that haven't reopened or have closed completely, what kind of waiting list is there for even the level 3 people or the group 3 people that has to be addressed? Like, is there a number of people that were receiving services before the pandemic that can't get services now?
Let me just check one thing. I thought there is no waiting list for category 3.
Well, I know there's not supposed to be a waiting list, but if there's not enough providers, you know, it's the same thing in the DD world. There's not supposed to be a waiting list for day services, but because providers don't have the staff or the capabilities right now to provide the services, we all have waiting lists. So I guess that's what I'm questioning. Were there people receiving services prior to the pandemic that are still waiting to get services today?
I'm not sure on that. And I can talk with Dawn and we can get back to you.
Okay.
I
great.
can write that question.
Okay, thank you.
I would just answer, Mary Pat, just anecdotally from the adult day program on my campus, that it's things have changed. The landscape has changed. A lot of families are more concerned about exposure, you know, to COVID, because that is still a really big issue. And a lot of our residents aren't keeping the masks on, and, you know, that, I mean, not residents, participants. So it's not that there's a waiting list, it's just that the landscape has changed and a lot of them are reluctant to, or their family situation, or they've kept them home more, or, you know, like they are definitely, the program directors are reaching out to their previous census. Some of them have moved in with family, like left the state, you know, like it's just not the same landscape as it was before. We're never going to return to that either. But I do believe there are new people that are newly eligible that don't know about the services. And yes, there are no programs like in certain sections of the state. And so it's way harder to connect them with program.
And I think too, sorry, I didn't do the little hand, but I think when she says there's no waiting list, that might mean that there's no waiting list to get into the waiver, but there might be a waiting list for somebody to actually have our particular service. Because once you're in that waiver, you could get home care service, for example. And so it may be more readily available to have a home service put in place as opposed to getting into a day program. That's just a guess, but a thought.
Sounds reasonable. Is there ever any, can you mix adult day center or adult care with home care? So in the day they go off to a day center, because that to me is more social. They're with people, they're being engaged, plus all the care piece. But then when they get home, that they get home services.
So yes, short answer is yes, there can be a mix, but that's also one of the big challenges that we've been working on, because that comes down to the access agency and case managers who are working with the client to arrange their service. So there's a few challenges, because an ideal situation for a client would be to have home care service for an hour or so in the morning to help them get up, get dressed, and get to the program. We pick them up, bring them to the program, and when they get home, there's a home health aide for 1 or 2 hours in the evening to help them at home. The challenge that the home care industry is facing right now is that they are very short-staffed and having trouble with staffing. Because of that, it's the home health aides particularly don't take these 1 or 2 hour shifts in the morning or 1 or 2 hour shifts in the afternoon. Instead, they want to spend the full day with the client or not come at all. And this is just from our communications with home care programs, and our association discusses this on a regular basis. So that's a widespread problem through the state. It's the staffing shortage for home care that makes it difficult to get that perfect blend. So instead, what you find is the client gets a home health aide that wants to stay with them for the full day because that's their desirable schedule. They oftentimes end up having a really good relationship with their home health aide, which we want. And then they're hesitant to leave the home health aide, even if they want to come to the day program. As a matter of fact, they want to bring their home health aide to the day program. They're like, well, can my aide come with me? And of course, we have to say no, because you can't have 2 services at once. So the windup is sometimes they end up taking their aide and going to a senior center, because they can have their aid at the senior center. Unfortunately, the senior center isn't quite, although it's a beautiful environment for seniors, for some of our clients that qualify for our program, it's not an ideal setting for them. They need assistance to be fed. They need assistance in the restroom, and the senior centers aren't set up for that. But they find it as a way to accommodate their home health aide, lose their home care service, and still be out and socializing. So we've been working closely with Miss Jennifer Cavallero and her team to help educate the case managers and access agencies about the best way to coordinate service and include adult day. So we're hopeful that that will change. But the short answer, Representative Garibay, is yes, we can combine the two services. In fact, it's ideal to do so. But because of the industry challenges in home care right now, it is difficult to make that work in reality. So we're hoping to explore that further and partner with the home agencies to better serve folks in the future. So yes.
Thank you for that, Christy.
Sure.
Okay, our time's getting short. I don't want to keep more than an hour and a half. There were a couple more things on our task list. Rep Hughes, for the next meeting, you were going to look at transportation to and from adult day centers.
Yep, I guess I got to connect with, I don't know who I should connect with about getting some data about that. I guess the area transportation regions.
Well, and maybe Chrissy and Cheryl know the challenges with the transportation and how it's reimbursed. I don't know.
We'd be
Good.
glad to talk about that if you'd like to speak with us, Representative Hughes, before the next
Perfect.
meeting, and we could
Yeah.
go over that together, maybe the three of us, and get some information and help you gather data, what you
Okay,
need.
great. Yep, I love that. Let's set that up, Chrissy.
Right. And Mary Pat, I had you down as in the next couple of weeks, issues for that developmentally disabled centers face in comparison to adult day centers. And Mag, what did you mention to look at next week? I mean, in our next meeting?
To maybe just have a discussion about the expansion of the under 65 home care waiver that's currently capped and what the cost of that might entail.
Do you need us to ask OPM or Office of Fiscal Analysis for previous?
Previous
Cost.
estimates,
Yeah,
that might be helpful. I don't know, maybe, or Dawn might have them. I don't know.
okay.
I'm just,
Okay, well,
you
we
know,
can
it
have-
seems like to me like that might be a focus of just at least a discussion of what the. if that's-
What would the
my
price
option.
tag be, right?
Yeah,
To know what we're looking at.
To lift the
Ju-
cap to
just
like,
so
you know, a couple hundred.
the category 4 that I mentioned, that is a separate program for that. It's called Connecticut Home Care Program for Disabled.
Mhm.
So that's the program that's for under 65.
Okay. And is there anything else that you'd like to see at our next meeting or hear from? If you do, just let Cameron and I know if you think of something. And I'm going to be reaching out to a couple of you with some side questions. So I'll be sending an email, just trying to get a grip on all of this. It's like, wow.
yeah, but, and I
right.
think Dawn mentioned like in the blue box, right? The regular general ABC, that adult day is covered under Husky C in there. So if somebody's in Husky C, they can go to adult day in the blue box anywhere. And I don't know if they've ever discussed expanding sort of long-term services and supports into A and B, and how that's even, if that's even possible from a federal perspective, you know, and how other states cover it. Because we've heard that other states do cover adult day in their state plan. So is it in their state plan, like in their aged, what was it called? Aged, blind, and disabled section. That's what C is. So maybe just, you know, Dawn might be able to fill us in on that. And just a general discussion, because I think that's really what we originally thought we wanted to do and asked for. And so maybe we really should get to the guts of that question of, you know, why it's only covered by the aged, blind, and disabled section.
Okay, that's a good question. Is there anything else? No? Well, it's been very informative. Thank you, everyone, for taking the time and being here and for reporting out. And Cameron will send out, we have 2 more dates that we set aside. So what's our next date, Cameron?
The next meeting is Friday, Thursday, October 27th at 9 a.m.
And if it's helpful, we can put those task items out when he sends out the agenda so that we know.
It's a reminder.
Right, it is. So that would be really great. And we're gonna have them send out so you don't have to go to the website and dig in. To have Cameron also send us the minutes
That'd be
right
great.
into our email, which will be quicker. Anything else?
Could we get Dawn's slides? Is that possible?
Yeah.
Those were great.
Okay.
The cost data as well as as what we'll always refer to as the orange box, the blue box, the yellow box.
And the green box.
And then trying to figure out where do I belong in those boxes, right? And but it is very helpful.
We're going to make it our mission to understand those boxes, and I'm actually hoping to meet with now, take this information to the executive committee and association so that we can all work together on seeing where we fit in the boxes. And then also one quick thing as well, if we could get the graph from Ms. Pooja, that was very helpful. Would you mind to indicate those dates that you gave me on the graph as far as the fiscal year dates where
Yeah,
it
that would
falls,
be helpful.
so we can just remind ourselves exactly what it represents? And it was beautiful. And thank you again so much for your presentation.
Great.
Just one thing. I'd just like to share with this group that Chrissy is now the acting president of our association. And so we wish her luck in her new endeavor with our group. We know she's going to be great.
Yes.
We're so lucky to have her.
Okay.
Thank you, guys. Thank you so
And
much.
one of my takeaways was that we have to educate our social services, our senior services, so that they understand what you're trying to, what we're all trying to understand, to help facilitate so that people understand their choices. Thank you so much for everyone being here today. I'll see you in a few